Emergency department preparedness for mass casualties is the central theme of this lesson, focusing on how medical facilities must organize themselves to handle large-scale emergencies. This title slide introduces Lesson 6, which serves as a critical guide for healthcare professionals and administrators. Mass casualty incidents, or MCIs, demand a level of readiness that goes far beyond daily operations. We will explore the specific structures, protocols, and coordination efforts required to transform a standard emergency department into a high-capacity life-saving machine during a crisis. Preparedness is not just a plan on paper. It is a dynamic state of readiness that involves every staff member and every piece of equipment within the hospital ecosystem. Throughout this presentation, we will break down the essential components that ensure an emergency department can withstand the pressure of a sudden, overwhelming influx of patients while maintaining a high standard of medical care. Importance of emergency department preparedness is the focus of Section 6.1, highlighting why proactive planning is vital. Rapid response readiness is the first core pillar, ensuring that the emergency department can respond quickly to MCIs without hesitation or confusion. Next, patient safety assurance is a critical goal, as thorough preparedness helps protect patients and deliver timely care, even when the system is under extreme stress. Finally, efficient use of resources is achieved through ready systems and protocols that optimize staff and equipment use. By having these structures in place, the department avoids wasting precious time or supplies, ensuring that every available asset is directed towards saving lives. These three elements form the foundation of a resilient emergency response strategy, allowing for a seamless transition from routine care to disaster mode. Activation of emergency response plans is detailed in Section 6.2, outlining the specific steps taken when a disaster strikes. Triggering emergency protocols occurs the moment an MCI or disaster is identified, setting the entire hospital's specialized response into motion. Immediate notification is the next step, where all essential staff and relevant departments are alerted to the incident to ensure everyone is at their designated stations. This leads directly into the implementation of procedures, where emergency tasks are carried out according to the pre-established hospital plan. This structured approach ensures that no critical steps are missed during the initial chaos of an event. By following these predefined activation sequences, the hospital can scale its operations rapidly and effectively, ensuring that the right personnel are in the right place at the right time to manage the arriving casualties. Patient surge management is the subject of Section 6.3, focusing on the logistical challenges of a sudden patient influx. Handling increased patient load involves specific strategies that ensure the ED can manage sudden influxes of patients without the facility becoming overwhelmed. Triage implementation is a mandatory part of this process, where patients are prioritized according to the severity of their injuries to optimize care for those in greatest need. Furthermore, the use of extra resources is vital, meaning that additional beds, specialized equipment, and extra staff are mobilized immediately to handle the surge. This mobilization allows the department to expand its capacity beyond normal limits. Effective surge management prevents bottlenecks in the emergency room, ensuring that life-saving interventions are performed as quickly as possible for the most critical victims of the mass casualty incident. Coordination with hospital departments is explored in Section 6.4, emphasizing that the emergency department does not act in isolation. Handling increased patient load requires strategies that ensure the ED can manage sudden influxes by utilizing the support of the entire facility. Triage implementation remains a central theme here, as patients are prioritized according to severity to optimize care and facilitate movement to other units. The use of extra resources involves the mobilization of beds, equipment, and staff from across different departments to handle the surge effectively. This interdepartmental synergy is what allows a hospital to absorb the impact of a disaster. When every department understands its role in supporting the emergency room, the transition of patients from the front door to surgery or intensive care becomes much more efficient, reducing the overall mortality rate during a crisis. Staff roles and responsibilities are defined in Section 6.5 to ensure a cohesive team effort. Interdepartmental communication is the first priority, where the EB coordinates closely with the ICU, surgery, radiology, and other units to track patient flow. Resource sharing is also essential, ensuring that staff, equipment, and supplies are allocated efficiently based on real-time needs across the hospital. This leads to a unified response effort, where coordination ensures smooth and organized patient care throughout the entire duration of the incident.
When every staff member knows their specific duties and how they fit into the larger response, the result is a disciplined and effective medical intervention. This structured approach minimizes errors and ensures that the hospital functions as a single integrated unit dedicated to managing the mass casualty event with professional precision.